Good morning, student. This class today is for introduction of common bone disorders. So, what are the goals? What are the objectives of this class? Is by the end of this seminar or class, we should be able to understand bone and its importance, division of bone disorder, and brief characteristics of each bone disease. So, what do you mean by bone? What is bone? Bone is living tissue that provides shape and support for the body as well as protection for some organs. Bone also serves as a storage site for minerals and provide the medium for the development and storage of blood cells. So, what do you mean by bone disease? Bone disease generally refers to the medical condition which affect the bone. So, any medical condition which is affecting your bone directly, which is known as bone disease, which comes under bone disease. So, it is a condition that damages the skeleton and makes bone weaker and prone to the heavy fracture. So, first disease condition what we are going to discuss here, that is known as osteogenesis imperfecta. In this pic you can see, because of weakening of the bone, that this tibia and fibula has been bowed. What is called, it's called bow leg. So these are because of weakness of the bone, it has bent. So brittle bone disease in the sense there will be a roughness of the bone which will make it weaker. Next is, it is caused by abnormal type 1 collagen synthesis and it results in bone fragility and susceptibility to fractures. So next you can see achondroplasia. So in this baby you can see the bow leg. So bone is not straight, bone is not healthy. Because of that only bone has been bowed, bone has been bent. So point mutation in the fibroblast growth factor receptor 3, that is known as FGFR3. It results in its constitutive activation. Next, it inhibits chondrocyte proliferation, suppress expansion of normal epiphyseal growth plate and several strand long bone growth. So generally it founds in long bone and it's inhibit the growth of the bone because bone is not in its normal fashion. It has been turned into different shape. Third is osteopetrosis. So a group of rare genetic disorders. You can say group of rare genetic disorders which is characterized by reduced osteoclast mediated bone resorption, and what it's making, it's doing defective bone remodeling. So bone remodeling means bone coming back to its normal shape but it is defective. It results in dense but architecturally unsound bone. So fifth one is acquired or metabolic bone disease. So disorder of bone strength usually caused by abnormalities of minerals such as calcium, phosphorus and vitamin D, bone mass or bone structure. So because of abnormality of minerals or indigestion of minerals, what will happen, that will known as metabolic bone disease, in which we will be learning next four types of disease. First one is the osteoporosis. First one is osteoporosis. Second one is Paget disease, that is also known as osteitis deformans. Third one is rickets and osteomalacia. And fourth one is hyperparathyroidism. So next disease is osteoporosis. Here you can see a diagram. There is a comparison between the healthy and osteoporotic bone. So the healthy bone is having the normal cartilaginous support at this base, and in between there are a normal tissue, normal healthy tissue, and the bone is normal in its shape and size. Whereas in osteoporotic bone, you can see the bone is spongy. So it looks like a sponge. As the sponge, you can see there are pores in between. Okay, so that gives an spongy appearance. So this is because of brittling or weakness of the bone. So osteoporosis is the most common bone disease. We can say it is caused by a reduction in bone density, which leads to more fragile bones and a higher risk of fracture. So this was about the lecture of bone and disease related to the bone. Next remaining disease we will be continuing in next lecture, and for the reference of this lecture you can follow these links. Thank you all for listening. Have a good day.